Hi, I'm Jeanette White. I'm one of the two senators from Windham County in the Vermont Senate, and I've been in the Senate now for 8 years. If I'm reelected, and I hope I am, this will be my 5th term. Of those, 3 of those terms, 6 years, was spent on the Health and Welfare Committee. Health is a huge concern of mine. It affects every other thing that we do. It affects all of our budgets, our school budgets, our town budgets, our state budget. We're spending a lot on health care, and we're not getting the results that we should be getting. We did a lot of health care reform around Catamount Health, the Blueprint for Health. There were about, I think, 39 or 40 initiatives that we passed a few years ago. Some of them are splashy and some of them are just behind the scenes. But we need to have universal access for everyone. In my opinion, that would be a single payer system. And unfortunately, a lot of people think of single payer not as the payer but as a single system where you're told where to go for your health care, who to go to, what to get. That's not true. It's a single payer. Right now we have a lot of payers and we spend a lot of money chasing that dollar for the payment. We pay on a fee-for-service basis, which doesn't make any sense at all. We should be paying to keep people healthy. So we need to continue the health care reform that we've started in Vermont, and some of the changes that are been passed by the federal legislation will enable us to do continue some of those changes. Some of those changes will require us to get waivers for what we want to do, and I think that we're in a position of applying for those waivers because we have been paying attention to health care reform in Vermont over the past few years. We have Catamount Health. I don't think that any of these are the answers. They're steps. We need to increase the coverage. Everybody has to have coverage. Everybody has to have access. But we also need to change the spending curve because we're spending way too much on healthcare for the results that we're getting. Other countries are spending less and having better results, but they're spending it more wisely. We're spending for people who have coverage and people who have access, we can spend a lot. For people who don't, they don't get the coverage and the access, so we don't have a good system. In fact, we don't have a system. It isn't that it's not a good system. We don't have a system of health care in Vermont or in this country, and we need to have a health care system. So that includes early intervention, prevention. We need to spend much more on prevention and early intervention rather than catastrophic care. We can avoid a lot of the catastrophic costs if we are willing to spend the money up front on early intervention. Every single Vermonter needs to have a medical home. They need to have a primary care practitioner that they can go to, they can talk to. The primary care practitioners can't be paid for spending 15 minutes with the person and then sending them off for tests. They need to be reimbursed at a level that will allow them to continue practicing. One of the things that I don't think we can do is change the system on the backs of the practitioners. And we seem to have been doing that all the time. Every time we have a decrease or feel we need to make cuts, we do it on the backs of the practitioners. And we can't continue to do that because our primary care people are going broke. They're not entering the field. We need to make sure that those primary care people, nurses, doctors, nurse practitioners, physician's assistants, the MDs, the primary care MDs, all of those, dentists, we need to make sure that dental is included in this, that oral health is a huge issue, mental health. They all are part of our health care, and we need to have a system that will incorporate all of them. So I am hoping that you'll send me back to Montpelier to continue to work on this issue that is so important to all of us, and we can see how it affects all of our budgets. We had a terrible budget situation last year, and you can see that in every school budget, every public budget, it's a huge issue. And in fact, every small business and every large business, it's a huge part of their budget. And we need to change that. And I believe a single payer system will allow us to provide better access, better care at a better cost. And some people will end up paying more. That's true. But most people, many people, will end up paying less. Those individuals who are now paying $16,000 a year for their family coverage, if they can pay based on their ability to pay in a broad-based progressive tax, they'll be much better off. Those employers who aren't paying anything will end up paying more. That's true, because they'll be paying for it in a different manner. The other thing, speaking of employers, that I firmly believe is that we have got to decouple health coverage from employment. People should have health coverage because they're residents of Vermont, because they live here, not because of where they're employed. It'll make it better for our employers, because our employers now don't have to compete with each other on whether they can provide health care or not. It'll make it better for people. They can go off and become entrepreneurs. They can change their jobs without fear of losing their health insurance. It'll be better all the way around. So those are just some of the things that I believe about health care. I hope that you'll return me to Montpelier in January so that I can continue to work on these issues. Thanks.